Hello, Fibro friends. My name is Carrie Kellenberger, and I'm the author of MySeveralWorlds.com. I'm a fibromyalgia advocate and part of Team Fibro at Support Fibromyalgia Network. And today's interview is with Marco Mizrahi from Spain.
Hey.
Marco has kindly granted us some time today for our second annual Fibromyalgia Community Conference. He has been an active part of Team Fibro for many years, and I'm so happy I get a chance to introduce you to him today. Marco and I have known each other for a long time, and I'd say it's almost close to 20 years at this point.
I say so.
It's a long time.
Yes.
Interestingly enough, I met Marco through ESL connections through my company, reach2teachrecruiting.com, when he was teaching in Shijiazhuang in Hebei province, China. And for those of you who do not know anything about China or geography, Hebei province is in northern China. It's around 3.5 hours from Beijing. And just to give you an idea of where I was 14 hours northeast of Beijing in a city called Changchun. So we connected over finding ESL teachers for his schools. And it turns out that despite China being a very large country, the expat community is actually quite small. So I'm constantly amazed at the friends that we have in common and the connections we have in common. And since then, Marco and I have become good friends. And of course, when I learned he suffers from fibromyalgia, we had more to connect with aside from our mutual love of cats, The Little Prince, cartoons, writing, and all things Asian. So Marco, I feel so lucky to have you in my life. And I know that anyone that is watching us today after today's interview, they're going to know how special you are. So let's get this Fibro party started and talk all things related to Marco Mizrahi, Spain's healthcare system, and how you are living with fibromyalgia and making the most of your Fibro Sparkle. So thanks for being with us today and for being such an active and positive part of Team Fibro. And let me turn it over to you. I've talked a lot. So why don't you tell us a little bit about yourself, Marco, and about your health journey?
Okay. Well, first, thank you so much for this opportunity. Thank you, Team Fibro. This is an amazing opportunity, and thank you for giving me a chance to share my experience with this invisible illness. A little bit about myself. You're gonna hear this again later, but I'm a world citizen. I'm a little bit from everywhere, but I was born in Venezuela. Then I grew up in the United States, and then I went to China. Like Carrie said, I would live in Shijiazhuang. I lived in China for 14 years, and then after that, right before COVID, I moved to Spain, and I've been living here for about 4 years. So I'm an English teacher. Teaching is my passion, and that's what I do. I just teach languages online, and I love also cooking, traveling, and all these things. And also love art. I like to post things online. I don't know if you've seen some of the things. I like posting things about humor, funny things, but also a lot of politics and things. As for my health journey, I like to describe my health journey into like the four ladies that I live with. Actually, I don't live with any four ladies. There are no golden girls here. It's my four ladies are my first one. It's so are the four invisible illnesses that I have to live with. The worst one or the most critical one is I have chronic heart failure since 2019, meaning that I have to take medication for my heart to keep pumping constantly at a normal rate. And I have to control my blood pressure and all these things. Then lady number two is Lady Fibromyalgia, the one that I have for the longest. I was first diagnosed 2002, 2003, and I was very stubborn because I ignored my symptoms. I ignored my diagnosis for many years until symptoms started to get worse and worse and worse. And of course, as life goes through and stress happens, it got worse. And I've gone points where I've been like homebound, even wheelchair bound, and it's been quite tough. The one that it affects the most is this one. And my other two ladies are Lady Asthma. Actually, she's the longest, even about the same time as Fibro. I was diagnosed in my 20s. It was an adult diagnosis of asthma, which is not rare. And the last one, the one that comes and goes whenever she wants, is Lady Depression. So that's my journey. Been living with those three constantly since the early 2000s, and CHF since 2019.
Wow. So that is so much I know what it's like. I know to have those cascading illnesses coming along that just affect everything in your life. How would you say that your experiences with fibromyalgia and your other diagnoses have affected you on a personal level?
Yeah, the thing that when you have an invisible illness, it's the thing that for me that affected me the most. Since I'm Jewish and I was born in a Latin American country. Family is very important. So having like your family not understanding and then being in denial, it's very hard. Like you explain to them and you tell them what it is, and when you have to tell them, what did you do today? I stay in bed all day. I could move. And then my father was always asked, like, but why, Dad? Like, how many times do I have to explain to you, like, why? What is fibron? What is this or what is that? And then it's denial, complete denial, and it's tough. But then your friends, your friends end up split in two groups. In the kind of the friends that actually understand what you're going through, and the friends that don't understand, like the same as your family. So
Yeah.
it's not that I'm gonna reject my friends that don't understand, but it's just kind of I make different plans with them. Like the ones that I understand, I know I can make plans that I can cancel, and the ones that don't understand, it's like it'll be very difficult to cancel with this person. They won't get it. Or if I keep canceling, they won't invite me. Like this used
Right.
to happen to me a lot in China. So it's I always cancel with my teachers that want to go out. I'm like, no, I'm not going, I'm not going, I'm not going. It happens. Yeah.
It does. It happens, and it's so hard to deal with. It's interesting that you mentioned your dad's reaction to it, because my dad is the same. Like he gets the arthritis, but he doesn't understand the fibromyalgia. And I know you're aware that I just went home this summer, and my parents, they were shocked. They were shocked at how my diseases and my illnesses have affected me. But I remember him 4 years ago, like, well, what? I don't really understand what fibro is, and I don't really get how it affects you and why it's so severe. And it's that constant state of trying to educate people, but then you kind of almost feel like they get sick of hearing about it almost. But they love you, but they also get tired of you being sick. So
yes,
it's a double-edged sword, isn't it?
Yeah, and one of my friends told me, because she's suspecting that she might be having fibro, so we were talking about this, and she mentioned how it's probably really difficult for our parents to hear that their child is sick. So it can be quite a shock for them, and our parents are the generations that therapy or anything like that is out of the question, or Googling it's what? Like they're allergic to computers, so it's very difficult.
Yeah, it's a rough go. I remember driving with my dad this summer. He was taking me back to the airport in Toronto, and there's a bunch of construction in that area, and he decided to go down a construction road. And I was like, oh my God, like I'm going to die. Like this is going to be so painful. So I was like holding on to the handle in the car, and he's like, Carrie, relax. Like I'm not gonna drive off the road. And I'm like, no, like this hurts. It's not that I'm gonna drive off the road. Like this is really painful for me. And tomorrow it's gonna be worse, and I'm gonna be on a plane heading back to Taiwan. He just didn't make that connection. So yeah, it's tough. So, as we all know, we're trying to bring more male voices into the spotlight to ensure that people understand that fibromyalgia affects men too, because the conception is that it just affects women. And especially at this conference, we are bringing a lot more male voices into things, and you being one of them. So what are some things that you think are important for men with fibromyalgia to understand and remember?
I think I was thinking about this question yesterday, like what to say, and then I think for guys or for men, it's an issue. It's a matter of thinking of like have I lost my manhood? I'm not that strong dude. Like what's happening with me? Like I can't do all of these things. So I want to tell every guy who's going through with fibromyalgia is like, it's you're still there. The guy who can do things, it's still within you. So instead of being the guy who can do everything and show everybody like you're the strong guy and you're the dude, uh, use that for yourself, like to tell your own body, like, listen, I'm the dude here. I need to do things. I need to go outside for walks. I need to exercise. I need to have a job. I need to support my family. So yeah, it's a fight. It's a fight between your brain, you're willing to live, and your body. Use that strength, that manly man strength to fight your own illness and garner that strength to fight it.
That's such a great way to put it. I really liked that. I know too, like, I have found that my male friends that have fibromyalgia are afraid to talk about it. I was just talking with a friend the other night, and I haven't done any phone calls with him, but we often exchange voice notes on WhatsApp. And I got a couple of voice notes from him at night, and he was terrified. Like he said he was really scared, and he didn't feel like anybody really understood him. And then he felt bad about messaging me, and I'm like,
Oh.
Like, I don't mind you messaging me at all. Like, it's great that you're acknowledging your feelings about this and talking to somebody about it. But I felt bad. I didn't know what to say to him, like to say, like, it's okay. Like, you're allowed to talk about your feeling. And I find that men struggle a little bit more to be open with that sort of thing, right?
Definitely, especially like the older you get, the more difficult it gets. If you grow up with parents like don't believe in therapy, and things like that, it kind of puts obstacles in front of you, like that you were raised with these obstacles, and then you have to learn to get rid of them. Like when you have fibromyalgia, it's not just a physical illness; it's also, I would say, it's partly mental health also, because it affects who you are in a big way. It's you can't do things that you used to do before. Like I used to travel a lot. I used to go to Japan 2 or 3 times a year. It's a 4 hour flight there, 4 hour flight back, and now that I'm still traveling, but I need assistance at the airport. I have to book. I booked 2 seats, that's why I can't travel so much, because I have to book 2 seats, not because of my size, because it's like I need to stretch. I need pillows. I need space. I'm tall. I'm 6 foot tall, so I cannot be like this on a Ryanair flight. So it's Ryanair is a low cost airline here in Europe, and seats are very small. So it's very uncomfortable, and so I need my space, and also the trip itself, the taking off, you feel the energy being drained out of you, and it's very tough. So it's a matter of patience. It's a matter of finding a balance between what you can do now with your body, and dealing with that side of, okay, I can't do this anymore, but what can I do now? It's important.
Yeah, it's acceptance with it, but there's also deep grief, and I understand that travel thing. I mean, I'm also a world traveler. I've been to over 35 countries, and we were traveling right up until 2014, and then it felt like this axe came down in 2015. And that was it. Like, I just could not do it anymore. And we were even trying to do staycations here, and I was struggling with staycations. Going to a hotel in Taipei, and just driving to the hotel, I'd need to take a day just to get over the. So there's a lot of grief and emotions, and also you're struggling to accept what's happening with you. It's tough. It's really tough. So I get that, and you express that beautifully. I know a lot of people are going to resonate with that. All right, let's shift gears here and start talking about Spain, which is one of my favorite countries, and it's placed on the Fibro World Map. I loved that Facebook post that you did a little while ago about kind of outlining how Spain is and how accessible it is, and I really liked how you introduced the city that way. I thought it was brilliant. You're so creative with that kind of thing.
Thank you.
So can you tell us a little bit about the Spanish healthcare system?
Okay. Well, it's the Spanish healthcare system. There are a lot of myths around it. A lot of people think, "Oh, it's free." No, it's not. It's not free. Sorry to disappoint you. It's free in the sense that you can walk into a hospital and you don't have to, pay for anything at the hospital. We pay taxes. We pay a lot of taxes for this, and that's how we maintain the social health, the healthcare system, the social security system, the pension system. So everything comes out of our taxes. This is a system that Spain came up around in the late 90s, because otherwise the country would have gone bankrupt. And so it's us Spanish citizens keeping up funding our own social healthcare system. When you go into the social healthcare system, it's a little bit. It used to be good. I still think we have probably some of the best doctors in the world, but there was a issue with during the pandemic. I think that drained them completely. Like, they're not as energetic as before. Also, the government reduced the time that you get to see a doctor, and then that's about 7 minutes. With your main. So you have your main doctor, your head doctor. You go see him when you have a cold or anything, and then if need be, he'll send you to a specialist. In my case, when I go to see him, and then he refers me to my cardiologist. The system has gotten so slow, or it's so overwhelmed, that it took nearly a year for my appointment to see my cardiologist. So I haven't seen my cardiologist since November of last year, and I'm gonna see him again next week. So a year without seeing a cardiologist for a guy with a chronic illness like chronic heart failure, it's not a good idea, because you can go through crisis. And then we called him, called the cardiologist. Listen, you need to see this guy. He's not doing well. And the cardiologist says, the system doesn't allow us to change appointments. Like, oh, okay. So these are the things that are happening. So the system. It's a little bit overwhelmed. Big cities like Madrid, Barcelona are really struggling because there is a shortage of nurses right now. But if you go to a smaller city like mine here in Malaga, other places, it's a little bit faster. So that's the healthcare system in Spain. It's free, even it's for everybody, but we're paying for it. But it has good doctors. It's just they're overwhelmed. A doctor here sees an average 1,200 patients, so it's a lot.
That's so many. I mean, I keep hearing everywhere, like I go to a lot of health summits. We know that our doctors and our healthcare systems are overwhelmed. In Taiwan, I don't really have any problems. Like if I need to see my rheumatologist next week, I could get in to see him next week. But our wait times are short, but then you only get like 7 minutes with your doctor, and then you're out of there. So
exactly,
it's tough, and that surprises me with chronic heart failure that you had to wait a year to see your doctor. Like, wow.
Yeah.
Man,
We
get a
have.
number on all of us.
Yeah, I have the option of going to the emergency room. I could do that. I did try. I ended up in the emergency room twice. Once in January, once in February. It was because I was traveling by train. So when I came back to Malaga, I was, of course, destroyed. And I told the taxi driver, like, please take me to the emergency room. And both times they told me it's psychological. And like, okay, well, once they told me psychological, the second time they told me you came to the wrong hospitals because we don't have cardiac machines here to do all the tests we need to do. Next time, go to the other hospital. We have 2 here. Like, okay, like fine. Next time I feel like dying, I'm gonna remember. Okay, the other hospital has the materials. It's like, this is crazy.
So is that kind of what you were talking about? Like you mentioned to me that Spain has tried to go through a humanization reform when we were talking about setting up the interview, and I wasn't really sure exactly what you were talking about. So is that kind of what you were talking about? And can you tell us a little bit more
Yes,
specifically about
definitely.
your terminology with humanization reform? Because I'm
Hmm.
assuming that story is connected to this.
Yes, there because they after COVID they were maybe burnt out, and they just had no patience, and also patients didn't have any patience with the doctors. So there was a lot of fighting, a lot of insults both ways, and things got ugly. And so first they started. The first thing is they started a campaign to stop the mistreatment of medical workers. So if you insult or say any a bad word to a doctor or a nurse, the police is going to come and you're going to be arrested. You're going to face prosecution. So it had to get to that point when it's something so common sense, like this guy is here to save your life. People people get angry, and like if they don't like the treatment or they don't like the way things were explained, they got angry and exploded. And so also doctors, it happened to me with I went to see my doctor about my asthma, and I was explaining to him that during the night especially I'm in a lot of pain, I cannot sleep, I have insomnia, a lot of things that come with fibromyalgia and night, they're a nightmare. And I explained all of this to him, and the worst thing that ever happened to me with a doctor, it's when he went like this. Well, your fibromyalgia, it's not really that. Inside of me, like I have every right to insult this guy right now, but I don't want to be prosecuted. Like I wanted to kill him. Like, what do you mean fibromyalgia? It's without the air quote. That
Oh,
was so disrespectful. It's like really, like, I've been living with this for nearly 20 years, and you're telling me it's not
there's
that.
what it.
Like, I wanted to tell him everything, any bad word I knew on the book, but I tried to do that. So, and then, so what we have on our side, when doctors behave like this, now we have a complaint and suggestion card or letter or thing. So you write on this paper, and this paper doesn't go to the doctor. It goes to like the local government, and then there is a person like an ombudsman in the hospital that will deal with this and then give a talk to the doctor, and then you cannot do this, like this patient complained about this, and then deal with the doctor, like give them a talk. And so this is the humanization that they're trying to do. So for patients to calm down, treat medical professionals with respect, and for doctors to be more sensible the way they're explaining things, and don't yes, you only have 7 minutes, but be more caring, show
Right.
that you care. Yeah.
Right. I mean, patients are the experts at what we're living with, and we keep hearing that over and over again. And I'm pretty sure that came initially from Michael J. Fox. God love him.
Yes.
But it's true. I wish that we got more respect from our medical care providers, because having a providers, put fibromyalgia in air quotes is ridiculous.
It's
I'm so
insulting.
sorry through that. So you were able to file a complaint with him about him. Is that correct?
No, actually, I didn't.
You just let you left it.
I didn't because the stress would have caused me to flare. So like,
Yeah.
I'll just leave it. He's only my doctor for asthma. He gave me my treatment. I don't have to see him again. So like, okay, fine. So I don't have to see you again. I don't have to see you again. Like,
Yep.
good.
You're wise. We have to pick and choose our battles. And sometimes, even though we want to do something like report somebody, at the end of the day, if it's going to make you worse, there
Exactly.
is no point in doing it. I know Crystal Kent did a presentation on how to file complaints through the hospital at last year's conference. So it'll be interesting to see what
Okay.
she comes up with this year, because she had a lot of
Mhm.
good points on
Mhm.
how to work through your healthcare appointments and record things. And I kind of do a similar thing here. I have not caught any doctors disrespecting me. Mostly I find that they're scared to talk to me. Probably because I'm a foreigner. I'm a Waibuan, right? And they're
True.
not used to dealing with us. They're used to dealing with Taiwanese patients and Asian patients. So it's a struggle. Luckily, my doctor right now is amazing, and I love him, and he's a hero. And his wife has fibro, so he gets it. and he knows it's not
Good.
a joke now. Okay, so let's get on to this whole EU citizenship stuff, and also your global citizenship. And you know that
Yes.
term resonates with me because I've been using global citizen for 20 years.
You're also a global citizen. Yes.
I'm also a global citizen. So you're a global citizen and you are an EU citizen.
Yes.
What happens to people who live in the EU when they do not have an EU passport? And what kind of help can they get?
Okay. So if you're an EU citizen and then you're going to travel to another EU country, you need to get the European health care card. So this way, every right that you have in your country, for example, free healthcare, and all the attention that you get, or discounts in medicine, and all these things, you can get the same in the country where you're traveling. So it's, for example, if I go to Germany, then I can go with that card because I cannot use my local card in Germany. It's in Spanish and it can't be read with their machines. So we have now a common European healthcare card that it can be used anywhere within the European Union. Switzerland, Norway, and Liechtenstein. If you are not an EU citizen and you're traveling here and something happens to you, God forbid, or then your best bet is to go to emergency room and travel insurance. Extremely important. Get the travel insurance. You don't need to have like a big healthcare health insurance thing. It's because it can cost a lot and it won't cover previous conditions. So for example, if you're having a flare and you're feeling well and you go to the hospital and you just got this travel insurance, it's not going to cover it. So one issue that be prepared. There are some hospitals that they will ask you for a health insurance card, and so have one. It's travel with it. A lot of people when they're booking their trips, like, what can go wrong? Well, you never know. You never know. So and you're already bringing chronic illnesses with you, so it better be safe. Just get a travel health insurance and you're covered. I had that experience with my father. Yes, I'm an EU citizen, but he's not. He's an Israeli citizen, very proud. He wants to have Israeli passport only. So when he was here visiting, he was also starting having heart problems, and I had to take him to the hospital. And when he was okay, you can also check online because something that happened with him in Madrid. We gave him the insurance card, but we didn't show the passport, and they didn't know he was an Israeli citizen. So a couple of months later, they sent him a bill for staying at the emergency room all day. But then when we're here in Malaga, the guy asked, like, can I have if you're not from here, can I have your passport? And they are countries that have agreements with the European Union, in which case that you don't have to pay. So even if you you don't need the health insurance. So you have to check if your country qualifies for that. I know because of my dad, Israel does qualify that Israelis can go to Europe and pay nothing. So that's the European Union healthcare system.
That was a great overview. I'm first of all, I'm really sorry to hear that your dad was sick and that you guys had to go through that. There's nothing worse than having family members get sick, especially when they're visiting you. And my dad also got sick when he was here in Taiwan, and it was stressful. Your other tip about travel insurance, that is an amazing tip, and I'm going to follow up on that later and maybe do a little bit more deep diving into that. Do you happen to remember the name of your travel provider, your travel insurance provider? Because I can't get travel insurance.
I can't get travel insurance either. If you have a chronic heart condition, you are banned from every single insurance company in the world. What to do?
It's not just me then. I thought I was special, and I was like, why can't I get travel insurance? And I was looking at getting stuff this summer because I don't have insurance in Canada. So I told my mom and dad, I'm barely stable with my arthritis. I'm going back to Ontario. My Ontario health insurance ran out in 2006. So as a Canadian citizen, I don't have access to healthcare. If something happens, we're in deep doo-doo. And then something did happen because I had blood clots, and I should have gone to the emergency room, and I didn't. I got on a plane and I got back to Taiwan, and I went straight to the ER, and that, well, you saw what happened online. So
but in Canada, it's sorry, but in Canada it's not renewable. Like, even because you live abroad, so of course you're not going to use the Canadian healthcare system. But because I have one of my citizenships, I'm an Israeli citizen because of my dad, and I have the Israeli healthcare system. It's different. You pay every month, and then you can go to the hospitals and everything, and you also have to pay for a visit. It's 5 shekels or something like that. And then, but because I declared that I'm gonna live abroad, then they put me on hold. So just, okay, you're still one of our patients, but so when you come back to Israel, you just start paying your monthly fees again, and then you're back in the system. Is it similar in Canada? It should be.
So Canada is similar, but they make you wait 3 months first. So there's a 3-month waiting period. And I can't even remember the last time I went like more than 6 weeks without seeing a doctor. So I can't wait 3 months to get but then you have to find a primary care doctor. And they're really hard to find because Canada is also experiencing a shortage. And then once you find a primary care doctor, you go on a waiting list to see a specialist. And the waiting lists to see specialists are 2 years. So that's actually one of the reasons why I've stayed in Taiwan. I have immediate access here. But if I go back to Canada, I'm looking at 2.5 years to get specialist care. So, which is nuts. Like, people think the Canadian healthcare system is the best, and it also has a lot of problems.
Yeah, like the Spanish one. Yeah, like waiting a year for a doctor. I had to wait a year and a half for a psychologist, and it's not like I was gonna have like a therapy with her. No, it's just 1 7-minute meeting with her, and she put me on antidepressants. Like, no. No, that's crazy. And it's getting crazy, and I miss that also in China. Okay, the doctors in China, they're pretty good, but they also have the same problem that they're overwhelmed. There's a lot of patients, especially on a Monday morning. Everybody comes, like, they don't go to the hospital on the weekend. Like, if you're feeling sick on Saturday, go to the hospital on Saturday, but then on Monday, everybody goes. But I miss that. Like, you go to the hospital, okay, you have to garner your strength. You go buy your guanghao, the ticket to get in, and then you go, you pay, and then you go see your doctor. But you don't have to wait. Like, you see a doctor immediately, and then if you need an X-ray, you get it done the same day. So I think, like, bravo for the Chinese healthcare system being so efficient. Maybe our systems need to, like, copy that.
A little bit. I mean, Taiwan's like that too, right? Like, our healthcare system is not the same as China because Taiwan is not a part of China. But, if I go and see my rheumatologist and he wants me to do X-rays, the X-rays and the blood work happen that day. If I'm doing an MRI, maybe I would make it a week before I get the MRI. But it's fast, and they have your results for your blood the same day. So if I go in and do my blood work, and I see my doctor like an hour later, he could pull up my blood results right away. There's no waiting around for lab results or anything like that. And we don't wait for our prescriptions either. So you go to the doctor, you stop at the pharmacy the hospital pharmacy, you pick up your prescription. You don't deal with any insurance companies or anything like that. It is literally a one-stop shop. And then I
Exactly.
look at what's happening to friends in North America, and they're like, oh, I've spent hours on the phone with my insurance company. I'm like, I've never even talked to anybody on an insurance company
Me neither.
call. It's
Yeah.
just all automatic here. So I feel blessed
Yes.
that I live in Taiwan for that reason alone, and why I wouldn't go back to Canada.
Well, yeah.
Yeah.
I don't.
It's so
I don't
interesting.
know.
I bet you
I
talk
don't.
a lot
I
about
don't.
that.
Yeah. I wouldn't go back to China. No, not right now. Yeah.
No, I wouldn't either. And I've got some really bad memories of, like the Chinese hospital system. You go in and
No.
then they're like, oh, you need to go up to the third floor. And then you go down to the second floor. And then you go back up to the fourth floor. And you go down to the first floor. And I don't miss that at all.
Yeah. It's messy, and the pollution and all of that. Like, no. Like,
Yeah.
so I'm staying here.
Yeah.
Blue skies.
Yeah, I hear you. All right. So we've done a great job highlighting, healthcare in Canada and China and Taiwan. Are there any associations in Spain that are helping people like you? So is there any Spanish association? Are there any Spanish associations that you want to highlight or tell us about?
Mm-hmm. To be honest, I've never contacted them any of these associations.
Mm-hmm.
To be honest, I'm very stubborn that way. So there is. I did Google this because I know there are a few. So there are two that I would like to highlight. One is CEFIFAC, SEFIFAC. It's an acronym for, I'll say it in Spanish, Sociedad Española de Fibromyalgia y Síndrome de Fatiga Crónica. So it's the Spanish Society of Fibromyalgia and Chronic Fatigue.
Oh, wow.
Yeah.
So they're so it's together, fibromyalgia and chronic fatigue syndrome.
Yes, yeah.
Right.
And it's, yes. So, and most of the things they have are in Spanish. The other one is AFIBROM, which is the Association of Patients with Fibromyalgia. And then something called Fatiga Crónica Encefalomyelitis, which I think it's
encephalomyelitis. That's ME.
Yeah, that's chronic fatigue. Yeah, chronic fatigue.
Yeah, we're trying to get away from using chronic fatigue and moving straight into using ME.
ME.
They keep changing the names on us, and it confuses everybody. So that's great if they're already using ME. I will email you afterwards to make sure that I've got those links so that I can pop them into the video information for Team Fibro afterwards.
Yeah. Yeah, AFIBROM is for people living in Madrid.
Okay, great. All right, we've got 10 minutes left of our amazing talk here. So I wanted to ask you, what are some coping techniques that you use to help with your day-to-day life with fibromyalgia? I've shifted gears again here. I'm trying to cover it.
Yeah. My coping, I have to be very patient with myself. And I try to take it slow every day. It's every day, baby steps. I have what things that I do at home is, for example, I notice that if I eat too much, I get very tired very quickly. So I skip breakfast. I only have a cup of coffee, and that's it. Because that way I have energy in the morning, and if I need to study, I can study. If I want to watch TV, I can do that. Or if I'm going to have a conversation with somebody or chat with people, I have the energy to do that. Now I'm going to the point where I can't type for too long. That just my hands just get tired and joints start to hurt. And then another thing that I do, it's I have chairs everywhere. I do right now. I'm sitting on my sofa, but I have in front of my kitchen. My room is very small. I won't show you because it's a little bit messy. But in my kitchen, so I have two chairs. I have one chair in front of the area where I cut things, and another and cook, and another chair in front of where I can wash the dishes. Why don't I just have one chair and move it around? No, I have a chair for each section. I have another chair. And of course, in the bathroom, if I need to shave or anything, in shower, I was talking to my brother. It was like, yeah, like it's so nice to take a shower. Like yeah, he wants me to move apartments to have a bigger apartment, and then he goes, "Look at the shower; it's so nice." And I told him like, "Dude, I haven't taken a shower in many years. Like, I need I take I take my chair, I put it in the. I have been in the shower, but not like standing up in the shower. I can't.
Right.
I take my chair, cover in plastic, and then take my shower, and then also in from the pharmacy I get these like special like towels. They're like sponges that already have soap in them, so they're dry, and then as soon as you soak them a little bit, the soap activates, and then you can wash yourself like without having to stand in the shower for such a long time. So you can sit down,
Oh, wow.
clean yourself. Yeah, this is something I learned from my pharmacist. Um,
Wow.
yeah,
That's I've never even heard of that before. I mean, obviously, like
yeah,
I've got a shower bench, but I've never. That's a really good tip.
yeah.
Yeah.
Thing I changed those for it that was kind of crazy. It's the small towels we use to clean the kitchen and stuff. I keep two towels in the bathroom just for me. Those are for my personal hygiene because they do the same thing. So I grab bath gel, put on it, and then use it the same way as the other one. Because the sponges are convenient, but they're made of plastic. They come wrapped in plastic, and I'm an environmentalist, so
Right.
I'd rather reduce plastic.
Uh,
Uh,
we could, we could have a whole new conversation just on
yeah.
how to save the environment with all of the medical equipment that we that
Yes. Oh my
I know
God!
everybody feels guilty about
Throwing
it.
throwing away medicine. Like it's now the in well, since we're talking in Spain, just a little parenthesis. Like in Spain, when you finish with your, I think I have one here. Yeah, like these things. When you finish with your medication and you have
Mhm.
these, you can take these to the back to the pharmacy and they will recycle it.
Oh
Yeah.
wow.
Yes.
That's really
Yeah.
cool.
That's why I
In
have it here.
Japan, we get wax paper, so they don't give us the foil packages. They put it in
Oh.
degradable plastic bags. People are
Yeah.
like,
Oh,
that's
that's
so
cool.
weird. Like they're not pill bottles, they're not foil wrappers, they're degradable bags. So, but that's
Oh, that's
really cool.
cool.
You take it all back. I've got a stack
Yeah.
of needles that I
Yeah.
need to get back to.
Yes.
They need to see me coming. I just come in with a bag of stuff. I'm like, here you go.
Yeah. So and another thing that I do to cope is to I try to relax, and also I have I should have taken it outside. I have a box that's my medication for fibromyalgia. I have my like all of these are my pills, but these are
Mhm.
only for my heart. So through the years, it looks like a lot, but it's one a day. So this is 28 days of medication. So because my doctor was having me like take this in the morning and take this in the evening and take this in the afternoon, and then I just thought like, what if I take all of them at once in the morning? I was like, same thing. I was like, okay, just save time. So
It's like
I
to be a
organized.
manager for our illness almost.
Yeah, so it's like then just let me take them all in the morning and save time
Yeah,
because otherwise I would forget. It's another problem with fibromyalgia. You get brain fog, and if you have fibro and depression, you don't take your medication. That rhymes.
right.
Yeah.
Yeah,
Yes. Yeah.
I hear
So
you.
it's kind of danger for me. That's dangerous. So like I need to have my pills. I have them next to me. I need to see them every day. Otherwise, I forget to take them. And I have a separate box with fibromyalgia medication
Yeah.
because I know like if I'm flaring, this is my box. And then it was everything it's in there is not nothing was recommended by a doctor. It was recommended by my pharmacist. He's awesome. Every time I go see him, he takes out a little chair so I can sit down waiting while he prepares all my medication. He's the best. And then but then he also recommended me like so when you're flaring and you're gonna stay at home, you can take this medication because it makes you really sleepy. It's a muscle relaxer and also has paracetamol. So it's both of it together, and it has a warning that you cannot drive while you're taking this medication. So it makes you very sleepy. So you take it only when you stay at home. And you go outside, you can take paracetamol or ibuprofen. So just try it. But another thing he told me, and he's like, if you're gonna stay at home, just on your sofa with all your cushions, and you're gonna be comfortable, try not to take any medication because it can affect your liver, it can affect your kidney because you're taking a lot of more medication that affects like your kidneys and your liver. So keep an eye on that. And be careful, don't take too much of what's in that other box. That's why it's in a separate box.
It's tough, isn't it? It's
Very.
yeah, I worry about all that stuff too as well. That was a great explanation.
Yeah.
I love that you got different boxes, and I like that you put a warning in there as well for everybody listening. About, you know, medications and how we could look at them or deal with them. So that's great. Before we sign off, because our hour just flew by here. I feel like we could talk for 6 more hours and cover a whole bunch of other things, and maybe we'll do that later in 2024.
Cool.
Are there any final words that you want to leave our viewers with? Is there anything special that you're working on at the moment, or any tips or encouragement that you want to leave us with?
Yes. So right now, so I'm not working on anything specific because I'm working on other things at my professional level. I'm trying to change careers. Sorry if any of my students are listening. I'm trying to switch to human resources because I think life is too short to have only one career. So I want to have two. So I'm focusing on that right now. But for our community, from time to time, I like to post things with fiber humor because I found those it's so easy to make fun of our illness. I know, and we need to laugh. You know, the world right now, it's so crazy with everything that it's going in, you know, in the Middle East, in Ukraine. Might be from Ukraine. If anybody from Ukraine here listening, Slava Ukraina, Yerevan Slava, and also it's very tough. So we need to laugh from time to time. So just to have a break from all the craziness that is going around us. And for people who are living with fibromyalgia and other chronic illnesses, I want to quote a very famous drag queen, Kennedy Davenport. She said, "The struggle is real," and you know, and it's true. Yeah, you are gonna struggle every day, and it's one day it's gonna be. Some days are gonna be good. Some days are gonna be bad. But remember, it's fibromyalgia. It's always manageable. You know, there are tools, there are resources, and above all else, look at where we are right now. We have a community. You know, not many people can say that. Like, I have the support of a huge community, and I think that's the most important message that I would like to say to everybody. Like, remember that you're not alone. There is an awesome community. These Fibro teams with you.
Yes, Team Fibro has your
Team
back.
Fibro. Yes.
That was amazing. Thank you so much from the bottom of my heart for taking time to speak with me today. And you were worried. That was perfect. I love that.
Thank
I
you.
love having the chance to catch up with you. Again, to our viewers, this is Marco Mizrahi. He's from Spain. He's part of Team Fibro. We are so grateful that you are part of Team Fibro. The nerds are here, and we are ready to rock and roll next month.
We will. Yes.
All right.
So let's bring it.
That was fantastic. Thank you so much for your time today. I really
Fantastic.
appreciate it. It was so good to
Thank
see
you.
you too and catch up. Oh,
Thank you. Thank you so much.
all right. Have
It was
a
wonderful.
wonderful day, and
Same here.
rest easy, my friend. I will talk to you soon,
We
and I
will.
will see you online.
Okay. Bye.
Bye-bye.
Bye, community. Bye bye.